Okay, so once again, now that we're live, I would like to thank everyone for joining us tonight. We really had this opportunity to share our story, but also share some of the real solid science behind what we do and why we do the program we do. And so my name's Kevin Rogerson. I'm kind of hosting duties tonight. I really had the opportunity to know and love lots of nurses that I work with, and have a couple that are really good friends of mine that wanted to also share how this program has helped change their life. And so we have a PowerPoint I'm going to pull up, and we're going to dive right into that. So just bear with me as I pull that up. And just kind of a disclaimer here, none of us are professional presenters. And so give us a little bit of grace and some love if we have something that might not go exactly right. Just hear our hearts and know that we're here to really share this gift with y'all that is something that we love. So obviously Nurses Moving Upstream is what it's called. A little bit of behind the scenes of why it's called that. The founder of our company, I'll talk about him some more in a minute, he really had this idea of moving upstream. And for us as nurses, what that means is we get the opportunity to kind of move away from the bedside with this program and really move upstream in healthcare and help people that, before they even have disease or illness enter their body, trying to help them focus on their health and achieving optimal health. So that's why it's entitled Moving Upstream. Our presenters tonight, so obviously me, I'm Kevin Rogerson, and some of our credentials as well. Lindsay Bard, you can see she studied for her nursing degree at East Carolina University here locally in Greenville, North Carolina. She also has her bachelor's in psychology from the University of North Carolina, Chapel Hill. And then Laura Kirk, another great friend of mine, she's got her bachelor's in nursing that she received from Indiana Wesleyan University. We are health coaches, which is why we are also here. We have this program that we offer people what we call the health trilogy, and that is body, mind, and finances. We're looking to develop your health in all those areas and help you work towards optimal health. We are also certified with the Villanova School of Nursing in a partnership with the McDonald Center for Obesity Prevention and Education. I think that's really important to know because we put in a little extra work, and we want to make sure we know how to assist you all at a high level. So something that we are indeed proud of. So this is me. This is my transformation. I'm not going to share a lot. Obviously, you can see my wife, decided to jump in with me and do this program. We lost over 101 pounds combined in 3.5 months. So we were very blessed by this program. Part of the reason why we are so passionate about sharing it with other people. First, our topics. So we're going to talk about our personal journeys. We're going to talk about shifting mindsets, talk about the statistics behind obesity and being overweight in America. Also a little bit about the science behind what we do, and then the rewards of health coaching and guiding people to change their lives, which is what we all enjoy doing as well. So just because we're medical people and we are professionals in healthcare industry, I wanted to throw this disclaimer up. I'm not going to read everything to you. Obviously, we would love to assist you, but we also know that if you have any kind of medical problem or illness or you're on medications, please talk to your doctor before you start anything. So first up is Miss Lindsay Bard. Like I said, she is a nurse, and she worked with me in the ICU in Greenville, North Carolina. We worked in the level 1 trauma center together. She actually precepted me and helped teach me how to be a nurse. So I'm really excited that she's on the program, or she's on the program, obviously, and that she's on the presentation tonight. So she's going to talk a little bit about shifting our mindsets and some of the stuff that we do as health coaches. So Lindsay, are you able to take it away?
I'm ready, Kevin.
Go for it.
All right. Thank you, Kevin. Hello, everybody. So like Kevin said, I'm Lindsay. Sorry for the feedback. I did the program about 2 years ago, and I lost 20 pounds in 11 weeks. I had 2 little girls, busy mom, and I just, I knew I needed to feel better, get my confidence back, and be a healthy mom and be a better wife. I was kind of gloomy and didn't want to do a lot, so I knew I had to make a change. I watched my health coach lose her weight, and I was like, sign me up. And then my friends started asking me what I was doing, and I started helping my friends. So that's a little bit about me, guys. And I am going to, thank you, Kevin, read my mind. Tonight, I'm going to take a few minutes to share something that can totally change your health journey if you're on it. And even if you're not on a journey, it can make you think. So 2 mindsets that we want to discuss tonight is a mindset that is motivated by conflict. It's a conflict-driven state. And the mindset we want to take you to, a perspective shift, is to be motivated by desired outcomes you want to see. And I truly believe, after being on this journey and working with others for over 2 years, that a perspective shift can be a total game changer, guys. So what we want to do, we want to change our emphasis from what we're against to what we're for. So let's say you have your current reality and then the reality you're looking for. Current reality, I have a health problem. I'm sick. I'm overweight. I'm miserable. Oh my goodness, I'm so overweight. I'm worried I'm going to be a diabetic. I'm worried I'm going to have a heart attack. To your new reality, motivate yourself by focusing on what's positive, what can happen, what can change. You want your goals to shift from disease prevention to being on that journey for optimal health. And I want to give 2 examples that are totally different to really drive this point home, guys. And the first one I want to present to you is something Kevin, Laura, and myself are very familiar with working in the ICU. Patients come in and they just have a whole plethora of problems: diabetes, hypertension, high blood pressure, high cholesterol, all these things that go along with being overweight. So you know what? Identify the problem. Yes, I'm overweight. I have diabetes, or I'm pre-diabetic. Yep, that's the problem. But you have to shift your mind to that solution, to finding a way to get to optimal health and seeing yourself in the future of what you want to be. Okay, I am a diabetic, but let's find the answer. Let's go to this. I want to control my blood sugar. I want to have my insulin regulated. I want to eat healthy. I want to overcome this. I want to stop taking these medications I have to take all the time for my diabetes. I want to be healthy, and I will do that. You know, you've identified your current reality. I have a health condition. And you've changed to your new reality where you see yourself in a more positive light, coming off the medications and being a healthier version of you. The second example I want to give kind of reflects myself a little bit. I wasn't sick. I wasn't in a state of sickness or disease, but I was in a state of not full-on depression, but being gloomy, not wanting to go out. Just being kind of blah. You know, let's say you're someone that needs to lose 15 pounds and you feel like you don't want to look in the mirror. You don't want to go shopping. You're hiding, in a towel at the beach. All right, you've identified that. I have a problem. I need to fix it. Okay, so see yourself in the summer. You know what? I'm going to be confident again. I'm going to be the old me again. I'm going to be happy. I'm going to enjoy shopping. I'm going to enjoy being on the beach with my kids. You identify the problem. I'm overweight and it's making me miserable. The new reality, I'm going to be the old me and I'm going to be healthy and I'm going to be confident again. So, research is showing that when you shift your mindset, when you change your perspective and your outlook, you will be more successful than people who do not. Thank you, Kevin. All right. How do I do this? You might be asking. That all sounds great, Lindsay, but how do I do this? Guys, it's simple. All you have to do is make a choice. Some of us just wake up one morning and make a choice. I'm not doing this anymore. I'm done. So when you make a choice, you start standing for that choice and you're willing to contend for what you want. Your actions will line up with the choice you've made and you'll be responsible for those actions. And you will not let anything come between you and your goal, that being optimal health. If you're someone who wants to lose 35 pounds, if you're someone who does want to come off their medications, if you're striving for optimal health, you will drink your water. You will eat healthy food. You will exercise. You will get sleep. You will work on personal growth. You will do all the things that our program embodies because that is what will drive you to optimal health. When people look at you, they will know you are someone who is healthy, who loves being healthy, who appreciates their body and what their body gives them. So I'm a very, very strong believer that food and exercise are not the enemy. Do I like sweets? I'm going to be real, guys. I still like cake. I'm not perfect. But I also realize my body deserves the right food, and the exercise is not the enemy, guys. I'm trying to shift, again, a mindset shift that my body is strong enough to allow me to exercise, and I need to do right by my body and give it what it needs so I can have optimal health.
Awesome. Thank you so much, Lindsay. I wanted to ask you a question too real fast. So I love that. This really, hold on, mute everybody. Okay, hopefully I got everybody muted now. Sorry.
No, that's
Goodness, let me see.
Nope.
Bear with me. Sorry. We'll figure this out. If you can hear me talking now, I'm trying to mute everyone. So please mute yourself if you can. I appreciate it.
252 72.
I can't see who.
13834.
Let me see if I can find it. Okay, so maybe that's it. So Lindsay, I would love to know. I love how like the shift in mindsets and stuff like that is so important to what we do. As a health coach, being with our program and helping people make that shift. How does that look? Like, how does it look for you to help someone as a health coach to shift? Or do we just sign people up for our program and then say bye, or do we do anything differently?
I think what sets us apart is we absolutely don't sign people up and just say, good luck, you got your stuff, have fun. We develop a personal relationship if they want it. We are there for them. We have their back always, and we set them up very strong with, our 4 components. We make it so they have everything they need to have very, very easy access to success if they want it. We're always there. They have. Would you mean to go into detail about the 4 components or just?
No, that's great. I'll cover those in a little bit. I just really wanted to hear your thoughts on that as far as health coaching because, and thank you. That's perfect. So go in the chat and put a 1 if you ever did anything in the past to try and get a healthier state or try to lose some weight. But, over time you kind of fell off or, you went back into some old habits. This is where what Lindsay was talking about is so important for us to help you with that behavior modification. Laura's going to come up in a minute and share some statistics, but one thing she's not going to share is the fact that 85% of people within 2 years regain their weight without behavior modification. And Lindsay kind of touched on that. And that's why it's so important that as health coaches, we have that one-on-one support for you, like Lindsay was talking about, that helps you move past that, okay? That's a really important piece of what we do. So I wanted to share that for sure because it really sets this program apart. Let's pull the slideshow back up, and I'm going to introduce Miss Laura Kirk. Laura Kirk is also a friend of mine that's a nurse, obviously, and she worked with us in the ICU in Greenville as well. The cool connection here is Lindsay precepted me and taught me how to be a nurse. And then I was blessed to have Laura come up after me and become a nurse in our unit. And I was able to precept Laura. So we've known each other for years now. She loves, obviously, being a nurse, but also a stay-at-home mom with her children. So she's going to come on and share about her story a little bit and about the science behind what we do. Are you able to be live with us, Laura?
Yes, I am. Can you guys hear me? Great. I just still cannot believe this picture when I see this before and after. So the picture that you're seeing on the left, let me tell you about that woman. That woman that was May. That picture actually was taken the last week of April in 2018. So this previous year. I was 236 pounds in that picture. I was 4 months postpartum from having my son. and I had a 20-month-old daughter, so my world was crazy. Everything felt like it was spinning out of control, and I had to go out to buy that shirt and those jeans because none of my clothes fit. I had gained back almost up to the weight that I was when I had my son in the hospital. So I had gained more weight since having him. The whole idea of, you know, breastfeeding and all the weight falling off just didn't seem to be true for me. So I was in a size, those were size 18 jeans. And then today, as it stands, I am 8 months into this journey. And I took this picture that you see on the right in my white shirt and those black shorts. Those are my old 18 shorts that I had bought this past April, right before I started this program. So I have lost 81 pounds. I have lost 6 pant sizes. I'm in a size 8 now. So I was able to do that breastfeeding my son, and then was able to switch the plan when I weaned him. So we've got a little bit of a different plan for everybody to suit every need. So I loved the fact that I knew that I could still feed him and feed myself, but still reach my goals at the same time. So it's been a crazy, awesome journey, and I'm still losing weight. I've got about, I don't know, 8 or 10 pounds more to go. I seem to keep dropping my goal weight because I keep realizing what's possible. So I'm like, well, if I can get even healthier than this, let me keep going. So what I want to talk to you guys about first is really the true weight of obesity. I don't think I really had any idea how extreme some of these statistics were. Obviously, I had seen a lot of overweight patients in the hospital. The three of us worked together in the trauma ICU. So we saw not only trauma patients, but trauma surgery ICU. And I'm telling you, this statistic right here, that 93.3 million people in the United States are considered obese, that's 1 in 4. That's 1 in 4. It is just amazing to think. And when we talk about obesity, we're talking about a BMI of 30 or greater. So just to put that in perspective, for me being a female at 5'6", that would have put me at more than 186 pounds, put me in the obese category. So I already told you guys I was 236. So I was actually 50 pounds into the obesity category, just to put that into perspective. So this is a BMI, a body mass index of 30 or greater. And can you believe it, that excess weight, obesity, and inactivity is responsible for 300,000 deaths a year in this country? When we think about things like car accidents, things that we cannot avoid, and yet we look at obesity as something that is truly preventable, that is causing death in this country. And some of the diseases that we encountered as nurses in the hospital, like heart disease, like stroke, like type 2 diabetes, and certain types of cancers, these are things that we can prevent by losing weight. And these are things that Lindsay, Kevin, and I are now getting to be on the other side of, getting to attack those things, not with medicine after they've already come into effect, but somebody like me, I was a decently healthy fat person. I didn't have any technically like diagnosed. I was not diabetic. I wasn't those things, but I was what this program calls non-sick. So I was not healthy, but I was still, I was sick. I was in that category. So complications from obesity-related conditions like these ones I've listed account for $147 billion in healthcare costs. And I thought this was very interesting. The medical costs for people who are obese is $1,429 higher per year than those who are not obese. And so when we look at, well, who all is that? So I'm in the category of 20 to 39 years old, and I know Kevin and Lindsay are as well. There's 35.7% of us are obese in that category. So if you're in that age range, 20 to 39, 35.7% of young adults are obese. 42.8% of middle-aged adults, 40 to 59, are obese, and 41% of older adults, 60 or older, are obese. So when you look at those statistics, do you notice an interesting thing, that those numbers grow as we get older? And so that prevalence of obesity, and then our risk-related diseases, our risks for those obesity-related diseases increases. And now this is sad. Look at these statistics about the youth in America. Adolescents 12 to 19 years old, 20% of 12 to 19-year-olds. That's 1 in 5 are obese. So these could be your kids. These could be your nieces and nephews. These could be, the kids at your church or at your job and these types of things. School-age kids, 6 to 11, 18% of these kids, y'all, are obese. And 2 to 5 years old, 13%, 13.9% are obese. So it is absolutely a problem, right? So we can see that this is absolutely a problem. What I want you guys to notice on these charts, this might be kind of hard to look at first, but I want us to look at this one on the left. So look at this one that says the path of disease. Those straight lines are baseline insulin and baseline glucose. So as a nurse, this matters to me. This matters deeply to me because this is the science behind why this program works. So this path of disease, this picture on the left, is how we typically eat. So those baseline insulin and glucoses, that's like a normal, that doesn't move, that's our baseline. But then this, the red line and the blue line show how our insulin and our blood glucose spikes, huge roller coasters, as I call them, with what we're eating, these high glycemic foods. So our blood glucose or blood sugar, or we call them sugars down here in the South, the sugars, spike way, way up after we eat these high glycemic foods, these heavy carbs, these sugary things, these bagels, hamburgers, fried foods. Our blood glucose goes way, way up. And then our insulin in our body has to go way, way up as well in order to accommodate for that. So there has to be this balance. So our blood glucose goes way up, our insulin shoots way up to bring our blood glucose way back down. And then we may go hours without eating. We dip way below our baseline glucose level, then we're starving, we're hangry, and then we eat way, way too much. And so that's kind of the pattern of disease where we, I hear people say that all the time. Well, I don't eat that often. I think that's honestly one of the main problems that a lot of, that has caused obesity. I know for myself, I can speak for myself that caused problems for me. It was not eating often enough. And so on this path of health on the right-hand side, I want you to notice that what we're doing is we're doing small meals throughout the day. And what this does is just bring up your blood glucose, just what you need throughout the day. So you're not having these huge spikes where your insulin has to shoot way up. On a personal note, I was doing some more studying today. When I was young, was diagnosed with polycystic ovarian syndrome. And so that's an endocrine disorder. So that's in the same family of diseases as diabetes. So there is an insulin component to PCOS. When I had my blood levels drawn some years ago, a normal insulin level was about 10 and mine was 100. So in order to keep a normal blood sugar, I had to have an insane amount of insulin going through my body. And that was also causing me, PCOS is actually a fertility disorder. So it caused me to be less likely to have kids. And so what's really interesting, now this is not like part of, the advertised program or anything, but what was really interesting was I had only been on this program 3 weeks when I got pregnant with my son 2 years ago. I had done this program for a few weeks and got pregnant with my son. And so it's my personal opinion that I think that this program and getting my insulin levels in check, not just my blood sugar, but my insulin levels in check, really did help me to become fertile enough to get pregnant. And I know that Kevin can vouch for this, that we've had lots of Optavia babies in our client list and everything, that people really have found that once we get holistically our whole bodies in check, it's amazing that our bodies do what they were made to do, honestly. And that's why, obviously, as a nurse, it really matters to me that I'm following a program that's backed by science. So with this program, we eat small, frequent, low glycemic meals and snacks. I love the fact that with the program, I'm also learning these things. I'm learning what is the glycemic index, what is a low glycemic meal. But at the same time, it's an easy program that I'm not having to spend all this time doing the science and the research and the studying like some other diets where I have to really create all the meals for myself. I'm just getting to learn it while it's been done for me. Do you know what I'm saying? So I'm able to have the mental space to figure that somebody else has figured it out so that they're able to teach me in a way that's easy and manageable for me. So this prevents our blood sugar and insulin levels from spiking. This is just what I was talking about. And then you're getting a constant, stable energy supply. That means your muscle mass is protected. So this means you're getting enough protein throughout the day so that as you lose weight, you're not losing your muscle mass. We want to protect your muscle mass. A lot of people ask me, is this like the ketogenic diet? Is this like Atkins? And really what those are, it does put you into ketosis. And this program does the same thing where it puts you into a mild state of ketosis, but it's not as extreme as far as the amount of grams of carbohydrates per day that you're eating as the Atkins and ketogenic. But because basically when you look at this, the physiology of what our bodies do, your body can only either burn glycogen or fat. So glycogen is what our body makes from carbohydrates, and that gets stored in your liver and your muscle. And when you go over 1,700 calories in your liver and your muscle, that then becomes stored as fat. And so that's what a lot of us are doing. We're eating so many carbohydrates that it overflows. Our body's not burning it up fast enough. It overflows out of our, can't pack anymore in our liver and our muscles. And so then we pack on fat. So this program, basically, we go beneath a threshold of carbohydrates so that we don't have that excess of glycogen in our bodies. And then our body turns to our next greatest store of energy, and that's all this fat we've got. And so what's awesome about that is you get this great level of energy. So you don't walk around starving because your body is thriving, burning up this fat that you've got stored. So that's what helps us to lose 2 to 5 pounds per week for the first 2 weeks, and then 1 to 2 pounds every week after that. And so I love that. I told you guys I've been on this program for 8 months and 4 days. And I'm telling you, I have averaged 10 to 12 pounds a month. So like I said, 81 pounds down, and there is no plateau. People ask me that regularly as well. As long as you're following the program and you've got fat to burn, you are not going to plateau. That is one of the beauties of the science behind this, is just purely that you're burning fat. And I love that our program is recommended by over 20,000 doctors since its founding. I think it was founded 39 years ago. Correct me if I'm wrong, Kevin, and is being used by 1 million clients.
Yeah, so let me stop share real fast because so first of all, I absolutely love that we have all this science behind what we do, because I think it's super important that it adds credibility to the program that we do, and it's not just us up here, preaching this is the new way and this is what you need to do now. No, this has been studied, and Laura's right. The science behind what we do, this program, the research and stuff has been ongoing for 30 years. And so there's lots and lots of research, and it's continuous research. We actually just had another clinical trial that finished up in the last year, and we're able to, replicate some of what we do. And I think it's a testament to our program that we have the research behind it and the science behind it, because it really backs up what we say when we say, I know I can help you lose that weight. It's not an empty promise. It's something we genuinely believe that we can help you do. And then, combine that with the mindset shift from what Lindsay was talking about, and really starting to not only help you lose the weight, but starting to shift you from, okay, you want to lose the weight, but why? And that's a really important question that we ask as health coaches. We want to know why you want to lose the weight, because that starts helping us shift you from the mindset of, I'm trying to attack this problem I have, to a mindset of, what am I trying to create? And that really matters, and this is judgment-free zone. We all, or the majority of us, started this program to attack a problem. So we're not saying there's anything wrong with you for doing that, if that's where you're at, or if you have a problem that you're trying to solve by losing weight. The truth is that's where most of us start, truly. But then we get the opportunity to shift that. Laura, how important is it for you? Let me ask you a question. How important is it for you that when you are talking to someone about this program and offering it to them from the health perspective, that you can back it up with a guarantee or with science?
Oh, I think it's incredibly important, because I think I think about that a lot, as far as hearing friends that have tried things that they think just sound good, or like somebody said that somebody once lost weight doing X, Y, or Z. And I wonder, like, oh, like, are you getting what your body needs? Like, has this been tested? Has there been clinical studies? And so absolutely, as a nurse, I think that that is incredibly important. I wanted to know that what I was putting in my body was not only going to help me achieve my goals, sure, but was it going to be healthy? Was it researched? Was it backed by science? And could I really count on it long term? I have been on this program for 8 months. So I would never do something for 8 months that was not really not only going to help me meet my goals, but was also going to be a healthy choice for my life.
Absolutely. Thank you. I second that. And I know Lindsay probably does as well. She'll third it, but I think it's so important that we can proudly offer this. We offer it with confidence, because we know that as long as you allow us to dive in and be that one-on-one support for you, that we're going to be able to coach you to achieve your goals. And that's a really important thing that we can offer with this. I got a couple more slides for you. I know we're going a little over, so bear with me. I do want to talk about the basics of our program, since now we've gotten a lot of the sharing out of the way of our stories and really the science and medical aspects of what we do. We do have a very basic program. It's simple. That's one of the strengths to what we do, is that it's simple. We're going to teach you to fuel your body 6 times a day, every 3 hours, and begin that within an hour of waking. We're going to teach you to drink 64 ounces of water. And so if you're on the call right now and you think, I drink a glass of water a day, maybe, that's okay. When you decide to start this journey, or if you're on it already, you know that what we do is we teach micro habits of health that we build on. And so we're gonna work towards that goal with you. It's not anything that you have to be scared of. You're going to receive guidance from a health coach, which is one-on-one support. And it's like Lindsay, I asked her earlier about this. This is not, hey, you want to do the program? Okay, cool. I'll get you signed up and we'll get you started. And then you never hear from us again. We're here to support you through the process and to guide you to the resources you need to be successful. One of those is our community of support that we plug you into. And then obviously there's a habits of health system. This is the education piece that's so important to what we do in this program. We educate you, we empower you, so you know what you need to do, not only to lose the weight, but also then to work towards this optimal health that we're going to try to transition you to. So when you hit your goal weight, for instance, when Laura loses 10 more pounds, because we know she's going to do it, what's she going to do past that? A lot of times you throw your hands up because you're like, I lost the weight now. What am I going to do? This program, losing your weight and being a healthy weight, is step one. And I love that about this program. The steps beyond that are where we go. And this kind of echoes back to that. I wanted to, in a clinical study that I was talking about that we just finished in the last year, we proved once again how awesome the program is, but also that the group on our plan versus the other group lost 10 times more weight than the ones that were being self-directed. So basically, that is the difference maker that comes along with having a health coach and the community of support that we offer. It helped people lose 10 times the weight. That's insane, right? That's huge results. And then, of course, there's a health coach piece to this, which is what Lindsay and Laura and I do, and thousands of people across the country. We get the opportunity to show people the way, help them grow a business and transform their life. I really wanted to talk about this, especially for the nurses in the house or the medical people, because that's who mostly is probably on this call. But this is really for anyone. You don't have to be a nurse. You don't have to be a health professional to be a health coach. But we do certainly find that people that have a heart and a passion for people in general, which are all different types of jobs that you hold. But if you have that genuine, authentic desire to help people, then health coaching is a great fit for you. And do you have to be needing to lose weight or needing to improve your health physically to become a health coach? I'm going to go ahead and answer that before the question pops up. It's a no. You can become a health coach and start utilizing our program to impact the lives of the other people in your life, your friends and your family that need help. And if you are on your health journey as a health coach, if you look at line 3 here, you have added a personal accountability. We talk about this all the time to clients that are looking for more accountability. Health coaching is a great way to add that accountability in, because not only are you on your journey, but you're assisting other people on their journey, and that adds that accountability. I know this is a big one for Lindsay, and if we had more time, we'd explore it some, but becoming the most fulfilled you. Lindsay, amazing person, stay-at-home mom, has got 2 beautiful children, and for me as well, this program gives us a bigger purpose. It gives us the opportunity to still help people and be home with our children. I came home in 2017 after being a coach for a little less than 8 months to be a stay-at-home dad and be a full-time health coach. And so now this is what we do from home, and it's a really important thing that allows you to still have all that healthy time with your family and friends, but be able to change lives. And once again, that echoes back to being incredibly rewarded for adding meaning and purpose to your life by paying it forward. That's it. We're going to wrap up, and I just want to thank everyone for their time. Went backwards. So reach out to a health coach today if you know one. If not, and whoever invited you to this call tonight, please reach out to them and let them hook you up with a health coach and get you started on your journey to optimal health. I'm going to stop sharing for a second. And I just wanted to take a minute to thank Lindsay and Laura for being a part of this. Great friends of mine, and willing to jump on and be live in front of, who knows how many people. So I really appreciate them. And, I didn't talk about it a lot, but this program literally changed my life. I didn't go into a lot of my personal journey, but I needed to lose a lot of weight, and I had probably lost 10 pounds, 30 pounds 10 times. I said it backwards before this. And those extra components that I talked about, the health coach, the community of support, and the education, were difference makers for me. So if you're looking for something, a lot of people are looking this time of year for something to change their health. This is surely an answer. So thank you all for being on. I'm going to stop recording, and I'll hang around for 5 minutes. If anybody has questions, just pop them in the chat or come off mute. But I'm going to stop the recording.